Hi, good evening. Thank you for joining us. This is another episode of Jeffco Health Matters, where we discuss the matters of health that matter to health here in Jefferson County. My name is Brianne. I'm the Public Communications Officer with the Jefferson County Health Department, and I am joined by Jackie. She is our Community Services Manager. She's an amazing human being, and she's actually talking about one of her projects that has been it's been a labor of love for a couple of years now.
So true.
Yeah, she's very excited. I'm super excited to talk about this one as well. So thank you for joining me. Do you want to just give us a little background about what you do here at the health department first?
Yeah, so thank you, Brianne, so much. My name's Jackie. I am the Community Services Manager. Engage with the community on many different spectrums, including environmental, drug prevention, health education, and one that is very near and dear to me, behavioral health, which is what we're here to talk about today. We were also hoping to have a couple of our partners with us today. Unfortunately, due to some scheduling conflicts, we were unable to make that happen, but we're hoping that a number of our school partners
Right. Yeah, we have, there's actually quite a bit of partners that are involved with this. Let's kind of just start that with a jumping off point, because in addition to obviously working at the health department and being our community services, you also kind of help head up this really great group we have within the community with all of the different resources and organizations. The JCHN, which is the Jefferson County Health Network. Can you tell us a little bit about the health network in general?
Yeah, so I think it was about 2017, the Jefferson County Health Department and Jefferson Memorial Foundation determined that there was a lack of coordinated communication within the community. There was limited ability to leverage data and resources. And around that time, they had done a great deal of research. They had done surveys throughout the community and really got a good snapshot of where some of our strengths were as a community and where some of our weaknesses were. One that really stood out was access to resources. Partners were working in silos, and one of our big goals was, how do we break down those silos? How do we offer a platform and a launching pad for all entities in all different areas of life can come together and really work together to look at how to solve solutions for issues going on in the county. So in 2018, unfortunately, Jefferson County saw a dramatic increase in behavioral health needs, including youth suicides in Jefferson County. So the health network began working specifically with behavioral health providers throughout the region, as well as almost every school, public and private. And for about 2 or 3 years, we came together and really looked at how we could work towards prevention, work towards getting more resources to the area, as well as developing an interactive, essentially, database more easily connect individuals to resources. And from that, we were connected to the intervention specialist with R7, who is an amazing individual. And he had a beautiful concept of a coordinated entry system utilizing a universal behavioral health assessment tool for students in schools. So of course, we saw how beautifully that fit with our idea of a network of partners and resource database. And so we were super jazzed to be able to look at how to utilize that concept and work with every school to do this. So we developed a task force in late 2018, early 2019, that incorporated counselors from Comtree, Provident, Mercy, Chestnut, schools and school administrators, and began working sometimes on an almost daily basis to develop this assessment tool and database. Of course, we eventually had to develop this platform electronically. So through the utilization of funds through the Jefferson Memorial Foundation, Missouri Foundation for Health, and Overdose to Action, we were able to get where we are today, which is hopefully this beautiful database we're going to be able to roll out soon.
Right. Yeah, so you specifically were talking about the behavioral health tool, which is like the official name for it yet. We're still in that process. We've all had our ideas of what we think would be a good name. But basically you kind of chatted about it just a bit there, but how did that point? Because we know there's a lot of need for a lot of different resources in the county. So what was the thought process behind, let's start with mental health. Let's particularly look at how we can assist our young folks in school and keep them connected to resources. What did that look like?
So I think a lot of factors played into it, passion being one of them. It's an area that I'm incredibly passionate about. A number of health department administrators are incredibly passionate about it, as well as we saw a need in the community. In 2018, again, we had that dramatic increase that we wanted to address immediately. And it was really in such an unfortunate time and a situation. It was beautiful to see these partners all coming together and working together for one common good.
Wonderful. Right.
The driving force.
Well, and I definitely think that, like, especially obviously with what you had stated with the uptick in, mental health needs and whatnot among our youth in 2018, we know there's this thing, COVID, you may have heard of it.
A little bit.
Yeah, right. It has definitely taken a toll on just mental health in general. So obviously, adults, workers, different things like that, but there's definitely a component here for mental health for kids, and whether they're in school, whether they did virtual, whether they're going back to school and they're excited, or they're going back to school and they're anxious, and just school years in general sometimes are difficult. So this is kind of a good time to kind of figure this out. I know it's been a project for a while, but I feel like this is almost a good time in light of COVID, right?
I'm a firm believer that things happen for a reason. And fortunately, we're dealing with this pandemic, but fortunately for us, we had started this process way before the pandemic. So even on the back end, you may not have seen a lot about it or heard a lot about it, but on the back end, we did not stop work on this. Our partners tirelessly, our internal team that works on it worked tirelessly to make sure that we continued moving forward. Because we knew, especially now more than ever, everyone needs mental health.
There's a need. Yeah.
Obviously, our youth are some of our more vulnerable populations. They don't always have the loudest voice. They've got hormones and, crazy things going on in their lives, where it's going to hopefully be able to help better identify which risk for mental health needs, which students are at risk for substance abuse, and really help these families and these counselors and these school communities quickly connect them to the resources that they need.
Right. So you and I have done a lot of talking about it, and we know a lot about this because, well, you obviously more so than myself, but let's delve into this. Let's share. You've brought up the demo. We have a demo to kind of like show folks just the tip of the iceberg, kind of what it looks like, and how the program is going to work. And there's some other information as well that we'll go through. But I think being able to see it first is helpful. It was definitely helpful for me to be able to see the platform. And just as a disclaimer, all of the individuals that are listed in the demo of this program are fake individuals. Jennifer Lopez did not, in fact, come to Jefferson County, Missouri and complete our assessment. So these are made up people, so to speak.
So what you are going to see is, like Brianne said, it is what we call our demo mode. So it is not connected to the real assessment. The assessment has not actually been rolled out yet into schools. We have been demoing it at a number of the schools and with our providers. But again, all the information that you see is not actual information. So what I'm going to share is what we call our student portal. So what you see in front of you, if I am a student, I am the amazing Jennifer Lopez. I go to Jaclyn R5 Herculaneum School. So we do make sure that everything that we have done has parent waivers, is HIPAA protected, is FERPA protected. So once a student accesses this, there's a lot of other pieces on the back end that have already been put in place. But what this enables me to do is annually or regularly complete a self-assessment. And again, this particular one is for 6th through 12th grade. So it will help my counselor, my school counselor, or my professional counselor identify if I am at risk for anything. So I already pre-filled this one out. It is not, again, this is not an actual person. It is not actual answers to the question, but just provides some very general questions looking at possible risk for mental health concerns or substance abuse. Once I am done, I submit that assessment, and it gives me this really in-depth summary page that can also be sent to my parents as well and my school counselor. It gives me an idea of what risk level I am at and what services are being recommended. Gives some general definition. Again, if I am a parent, which I am a parent, I have children in schools in Jefferson County. So as a parent, I would understand that there is a risk, what that risk level means. And I am also, before my child ever walks into a counselor's office or ever steps out of this moment, I am immediately getting access to particular resources. And these are vetted resources that were provided by licensed counselors in our area.
As a side note, I really liked that 100 coping strategy. I'm going to have to print that out for myself in the office because that was just a really great one. Just as a side note for anyone who was interested.
As a mom with children very close to that teenage year, that is one I'm looking at myself.
Right.
Some of those strategies. So again, I'll wait till the counselors are on in the fall, but there are some amazing tools out there where, again, my child may not necessarily need counseling service or need substance abuse service, but as a mom, I may just want to give them coping skills. So when they're with homework, when they're struggling with how to make friends, that I have resources now that I know that I can go to utilize. And one of my favorite pieces is every student, every parent, every staff member, every counselor is going to be connected to a very in-depth resource database. Right. I've built it out specific to behavioral health, but over the next few months, we are going to be building it out to encompass housing resources, food resources, electricity, dental health. So essentially everything that a person would need to thrive in our community, we're going to make sure that they can easily be connected to those resources.
I have to stop you there. That is amazing. Like, I'm staying in, I know I'm like tooting our own horn because I'm part of the organization, but this is just, it's incredible what you guys have worked on. I'm so excited to see it in action. So, okay.
I know this is what honestly we started with. And then of course, once you get some brilliant heads around the table, it grew and grew and grew. But it started as the resource navigation tool, which my background, I was in Head Start for many years in administration and saw the struggle my staff, our community was in, just trying to easily connect to resources. Sometimes you don't realize the amazing resources we have at our fingertips. So what our developers did so beautifully with this is they took the school that this particular student is in. So I think in this one, it is the Jaclyn High School. So it geomaps with every single school, not just district, but building, because each district is set up slightly different. So in this particular building that I attend, it shows me that the counselor that actually is at my school on these particular days, and again, this information is being updated. This is a demo, so I don't know that this is a counselor. So this information is available for them to be able to access. Email, it shows which services, as well as it takes my physical address, which again, this is a pretend person, so it is a St. Louis address, but it will show what counseling services that I am in need of are close to my house.
Right.
So if I have transportation issues, if there is something, if I have a particular insurance, if I need Medicaid, or I'm not insured at all, this will help those parents and counselors identify the appropriate resource within seconds, versus going through a phone book or a call list or Google. It will really help expedite that process.
And this is the student portal. I know we have a counselor portal, which is the one that you're going to pull up here as well. And then once we kind of look at that, we'll go through some of the questions about like what does this look like? How is it rolling out? What is, is this a mandatory thing or, things like that? Because I'm sure those are questions that parents have. And we are definitely going to address it, but I think it helps to really get that visual first.
Yes. And I apologize. It takes me just a minute to log out of one and into.
That's okay. I'm going to scroll through and see if we have any questions so far. Oh,
perfect.
We have a lot of thank you for what we do. That's exciting. Got some people asking COVID questions. So I'll go back through and answer those questions for everybody.
And it was like
in the chat
said from the beginning, this has been a labor of love. Yeah.
Great. Yeah.
This has been so many partners have been part of this process. All right. Sure. So whenever you're ready.
Yep, go for it.
Awesome. So again, what I'm going to share with you now is our demo of what the counselor screen is going to look at. So again, more exciting pieces, but just knowing that the individual that you see is not a real individual that we've completed an assessment on, and it was developed for the purpose of the tool. So what you see here is our counselor page. So each school will look slightly different. So particular either school counselors, social workers, or licensed counselors will be identified in each school district or school building to be working within the system. They will not necessarily have access to every student within their district. It will be determined as to what their administration feels is appropriate. So for example, this particular counselor is going to get some de-identified data to show some general information on what's going on within their county or within their school, which is going to be really helpful. So if they start to note that they're getting some increasing moderate and high risks, if all of a sudden within 24 hours, they had 20 students come on and complete a self-assessment mid-year, that may trigger them to, do we need to put additional resources in place? Is there something going on? It may also show if they're over the years getting a lot of decreased risk levels, that may be a great thing to say, what are we doing that's really working and helping these kiddos? So it's not always on the negative side. It also is going to give them essentially a triaged list of these students have completed the assessment tools, or they were referred by a fellow student or staff member. And it helps them triage by those high and moderate risks. And then they can identify if they need to talk with that student further and pull them in. And what's exciting, if they do pull them in to do an assessment, again, they are not asking questions out of thin air. They don't have to do paper copies. They've got the general assessment tool right here. It can also search for students very easily that they have access to. Sorry, I'm not a fantastic multitasker. Saves all their information. So again, our whole goal was to take what used to take certain counselors or licensed counselors hours between getting paperwork done, completing the assessment, finding resources, shrink that time down. So the time that they do have, they're focused on that student and they're focused on the task at hand and not focused on the paperwork end of it. So again, just a real quick, easy flow assessment tool that helps identify risk level, helps identify if they are at risk for substance abuse, and also identifies, of course, our worst case scenario if they're at risk for suicide. And again, that triggers a Columbia model assessment tool, which goes into more detail. And again, we'll demo this again with our counselor.
This has all been vetted. Like, this isn't just something that all of us sat down and we're like, hey, this sounds like a question. Like, this went through multiple layers of professionals at regional.
Multiple.
Yeah, like this was a very long process to get here. And these are vetted.
Yes. We're talking months of work. So what you guys are seeing on your end has been months and months of work on everything, by how each question was worded, each tool that we used, each way that the question was clicked. Is it a box? Is it a circle? Obviously, we know this is going to continue to grow. There's little things like certain sentences may be bolded or, aligned this way. Those will continue to be updated. But yes, everything was vetted through the school task force, through our licensed counselors in this community, again, from Mercy, Comtree, Chestnut, Provident, as well as we brought in individuals from the state level, from Missouri Behavioral Health Network, to also go through the tool with us, vet some of our questions and scenarios, and really work with us to make sure this is the best possible tool for our students and staff. And it also is going to, what's exciting is the staff member now doesn't have to be worrying about algorithms or things on the back end. They can be really focused on the moment. Other than a few clicks, this is going to change the level of risk for them. So again, they're focused in the moment. They're making a few clicks here, and they now know what their next step needs to be as far as how to identify where to connect that student to resources. And when they get to the end, and I know I'm rushing through this, but we'll go through all the assessments again. It will connect these individuals to resources again. So we will have counselors, instead of them going through Google themselves or, contacting agencies that they know, it will give them that immediate provider directory, just like it did the youth, that again connects them to the appropriate resources really quickly. And it can even go down to if they have an eating disorder, if they're having behavioral health issues and substance abuse issues, what is the best resource for them? But one of the things is making sure they're directly connected to their Comtree liaison, to their Chestnut counselors, to their counselors that are also in the school.
Right. And so one of the things that we wanted to chat about too, because I know we're kind of coming up on time, but we want to make sure we hit these. We talked about it a little bit. It went through a pretty rigorous vetting process. Obviously, it meets the, confidentiality requirements.
Yes.
It's FERPA. And this is also something to note that this is not a database where you can type in like Jefferson County Health Network behavioral tool and anyone can find this. This is not a Googleable website. This is a system, a database, basically.
Mm-hmm.
Limited individuals have access to. So this is not anybody within the school district can just, get in there and get, little information. This is limited to the counselors that will specifically be working with little Johnny at that school, not, anybody and everybody who wants to see what's happening. So a lot of time and thought has gone into this.
Yeah, a lot of it is HIPAA and FERPA protected. Like I said, from the beginning, there's parent waivers. There are multiple layers of protection that we wanted to ensure were built in, as well as I myself, the Jefferson County Health Department. I can't just access student profiles. I can maybe get some de-identified data to see how many students throughout the county have completed the assessment, things like that. I can get into the provider end to make sure things are updated, that staff are changed as needed, but I am never looking at any student information. And that is very protected within each school district and even within the schools. Some of our smaller schools, you may have one licensed counselor that works with all of the students in that entire district. Some of our bigger districts may have multiples. So we will make sure that each school, it is designed and implemented effectively for that particular school.
Yeah. So one of the other things too, as we're kind of wrapping up, basically, what is it? Because we wanted people to see it. This is a proud moment. So what does the rollout process for this look like? What should people expect? What should parents kind of expect?
So we have already begun working with some of our local schools. Again, we're in mode. So we're hoping this fall to be able to actually roll it out with training for all of the schools. Again, that might look different as to how many counselors or how many staff are trained in each school, but we're hoping that full rollout to all private and public schools in the county happens this fall. And then as soon as we get to that, there will be campaigns around it. There will be videos for parents. And that's where I will take a step back and let our experts and our school administrators really step forward and talk to their families and their parents about what this is going to look like for their school environment and how parents can enroll their children and how it will roll out in years to come.
Yeah, so if you're an interested parent or somebody involved in the district, stay tuned because you're going to get information from your district. Not quite there yet. We kind of wanted to just tease it a little bit so folks know. So I'm going to go through the questions really quick and see if we have any. I know there's a handful of questions on here that are related to like COVID and stuff. I will go back through the chat later and answer those. I'll type out answers to those questions. Don't see any questions relating particularly to this platform.
Okay.
So I think everyone was just maybe so genuinely amazed by it that
we're going to go with that.
Yeah, we're going to go with that. Okay. So again, if you guys have questions about it, you can always down in the comments below. We can get to them later. You can always reach out to us at communications@jeffcohealth.org. If you've got questions about COVID or any of the school policies and things like that I'm seeing in the chat, I'll go through those over the next day or so, and we'll get you the information that you need. We actually have another episode of Jeffco Health Matters in 2 weeks. We do this every other Wednesday. So be sure to tune in for that. It's on Facebook Live at 5, and then it goes on YouTube the next day. So feel free to share it with your friends. And it doesn't look like we have any other questions. So we'll call it an evening. Thanks for joining me, Jackie.
Thanks, Brianne.
All right. Bye, guys. Thank
you for watching. Bye.